Welcome to the next episode of 62 Who Knew. Glad to be here. We're here in Florida in the middle of a monsoon, but we came to the studio anyway because nothing stops 62 Who Knew. Today is one of our favorite guests. She's been here before. She's also one of our national sponsors, Miss Diane Daniels, the president and founder of Medicare Nation. Reputation nationally well-known, speaking throughout the country. I don't know if there's anybody, or if there is, very few people that know more about Medicare than Diane. So welcome back.
Michael, it's always a pleasure.
You came to through the monsoon to be here too.
That's Florida.
That's Florida.
We're used to it.
The last time you were here, which was about 8 weeks ago, 8 weeks ago, you, for lack of better terms, warned us that changes are coming, and some of them may be good, and some of them may be very bad. Well, with open enrollment season, 20 days away, October 15th?
Yeah.
You're here to tell us about some changes.
Yeah.
Not all, because you haven't got them all, but some of them aren't so good. So as a 67-year-old on Medicare, tell me.
Yeah.
Tell me what's happening.
Well, people, you got to pay attention because some of the changes are so important and going to affect you, and you've got to pay attention. So this one is a pretty good one. So in 2025, we had the prescription payment plan.
Right.
So if someone walked up to the Walgreens counter and they said your prescription was going to be $700, okay, they were able to opt into a Medicare payment plan, and they didn't have to pay for it at the counter. Your carrier would then send you the bill, and they would spread it out over the year. Mm-hmm. So that's going to continue, and to make it easier for all of you, if you have opted into the program, it's just going to automatically renew.
Makes sense.
So you don't have to worry about, am I in the program, not in the program? Just renew. And it will do that automatically until you tell them, I want to opt out. If you're not in the Medicare payment program and you want to be, you can opt in anytime you want.
Oh, that's not just open enrollment.
It's not open enrollment. It could be any point during the year. And that's going to be especially important for anybody that comes down with a chronic disease or serious injury, and the doctor prescribes you some very expensive medication. You can opt in right then and there, and they'll spread those payments out over the year. So that's a good thing. That's continuing. So that's one very good thing. Next is going to be your out-of-pocket expenses under Medicare Part D for the year.
Okay.
So last year it started that it was going to be $2,000 was your maximum out of pocket. That includes your deductible, what you pay, and then what you pay out of pocket actually for your prescriptions.
Okay.
So people are pretty used to inflation indexing.
Yeah.
Okay. Whether it's how much they're going to contribute to an IRA or tax returns, or they might have heard of the term before. So Medicare is going to start using that for this cap. Mm-hmm. And we're starting in 2026, and they've raised it now to $2,100. So your out-of-pocket maximum for the year for Part D prescription drugs is going to be $2,100. If you have a deductible, it's going to include that towards it. And if you hit that $2,100, that's the most you're going to pay for prescriptions for 2026. Okay. After you hit that, then your plan is going to be responsible to cover your out-of-pocket responsibilities for your prescription medications under Medicare for the calendar year.
Also not so bad, is it?
Not so bad.
It's about $170 a month.
Yeah.
Yeah, and that could be, God, with the price of prescriptions with pharmaceuticals today, that could be nothing.
Well, 2 years ago, I were having clients that were paying $7,000 over $8,000 a year.
Oh,
all right,
God.
so it's a far cry from that.
Yeah.
And we're doing better, so we can take the $100 increase. I'll be concerned, other 5 years down the road if we're going to continue to, do it with inflation. Now, some years, if inflation comes down, it might be better because then they'll relate it to that.
Okay, so far so good.
So we'll see what's going on. All right, so how about the Medicare Part D deductible? Most people, beneficiaries, are very used to when CMS is going to come out with the deductibles for Part A and Part B for 2026. That could be any time, folks, somewheres in the middle of October until December 31st. There are years that they cut it very close, and then there are years where you got someone in charge that's doing this properly, and they give it out to us, proactively. So we have to wait for that, but Part D is here. And people don't pay attention to the Part D deductible because they didn't know that it could be different on any plan.
Oh, wow.
Now, Medicare sets the maximum amount that a carrier can say your deductible will be, And that's going up. This year is $590. It's going up to $615 in 2026. Okay. But every plan, some plans have no deductibles. Some plans you might have a $150 deductible, or $250 deductible, $400 deductible, $500 deductible, $615 deductible. It really is important to know what your medications costs are going to be and to find a plan that will help you find the lowest out-of-pocket costs, including that deductible.
So many people, I've said this before when you were on, they don't realize how many options are out there, how many plans are. Again, I have relatives, I have friends. Yeah, it's my time. I know open. I'm going to go online and do a little research. And it's like saying I'm going to go online and research the surgery I'm getting.
I know.
You don't know what you're doing. You have to have an expert. I mean, it's just amazing because at our age, this is not a small decision.
Yeah.
This is a monumental decision that affects your health for the rest of that year until open enrollment comes back again and you can correct your mistake.
Yeah.
Unbelievable to me.
So, folks, I'm telling you, you need to really sit down, write out a list of your prescriptions. I know so many of my clients, they're wonderful. They type out their prescriptions, the dosage, how many times per day, and they put it on their refrigerator in case, God forbid, they had a heart attack and the ambulance had to come in. You know, when they're looking around for medication, there's the list right there on that refrigerator. They're sweethearts. They do that. You should do that too.
Yeah.
Okay. If you're 65, you should be doing it because you need to sit down. You need to talk to a professional and you need to find out which plan is going to be the right plan for you. Among other criteria, your prescriptions is pretty important.
Yeah.
Because there's so many different variations in out-of-pocket costs. But the ones will be $2,100 for next year.
All right.
Okay?
All right, we're good.
Not too bad?
So far, we're doing okay with
You're
these.
all right with all this?
So far.
I don't know how all of you are thinking right now, but so far not so bad.
No, I don't think it's great, but not so bad. But I have a feeling you're saving the bad stuff for later in the list.
I don't want to scare people off the show.
Okay, that's good. Keep watching. Things are great. Medicare is great. I won't say we're going to make Medicare great again. I will not say that.
So people have seen on many Medicare Advantage plans called supplemental benefits. The best is going to be on the commercials. I go crazy, and you see them too because, you know, we're here in Hillsborough, Pinellas, Pasco County. How many times have you seen the Optimum commercial? I think her name is Betty or something. It runs every day, like 15 times a day, all year long. It's giving me a headache.
Yeah.
Okay, it's all day long. But they talk about free groceries. Okay, it's so deceiving for people because they see something like that and they pick up the phone and they want to call and find out how they can get free groceries.
Right.
Okay, folks, it's television. It's an ad. Okay, they want you to call, and once they got you on the phone, okay, they have to ask you what's your zip code, blah blah blah, all this stuff, and then they're going to explain to you, oh, you don't qualify for free groceries.
But meanwhile, they got you on the phone and your information.
There you go.
Are you saying that everything we see on TV is not true?
I am saying
I
that.
don't believe it. Let me ask the producer. Can people handle the truth?
You can't handle the truth.
I think that's the problem in the country today. People just can't handle the truth.
They can't.
But here at 62, who knew? Yeah, we tell you the truth.
We got to tell you the truth.
Diane's telling you the truth about Medicare.
I am. So you hear that commercial, and in many parts of the country, in your areas, you have commercials, you know, with Medicare Advantage plans that are talking about free groceries also. Not everybody's qualifying for free groceries, okay? So you have to have a chronic condition.
I was just going to say, if you're qualifying for free groceries, and I wish everybody did, am I wrong for saying if you qualify for that, you're probably in bad shape?
Well, you have a chronic condition. So you have your diabetics. You have beneficiaries with respiratory issues. You have people that have cardiac issues and things like that. So people that are on specific chronic plans for those conditions, they are more prevalent to have these grocery cards, I'm going to say.
Right.
Now they're also putting in the all-in-one kind of card where you can get groceries, you can get over-the-counter, you can get all the Band-Aids you want from that kind of card. If you want to go play tennis, they'll pay for your fees.
No.
Oh, yeah. If you want to go get teeth cleaning, you can use it towards your dentist. You can use it towards a hearing aid. So it's the all-in-one, use it as you would, you know what I'm saying, kind of card.
The tennis thing threw me, but the rest was okay.
Yeah.
Play tennis in the summer in Florida. You'll have a heart attack, and then we'll give you free groceries because because you'll have a cardiac
There you go.
condition.
So that's a big caveat people don't understand. Not everybody is getting this free groceries card. Now, there are some plans that do have the supplemental benefit in a regular plan, but you must be diagnosed with a chronic condition in order to get that supplemental benefit. It's not available to everyone on the plan. Now, what Medicare is doing in 2026, they are now labeling the items you cannot purchase with your grocery card because people were taking advantage. Tell me some things you think people were buying with their free grocery card.
I'm gonna go with cigarettes, beer, and wine. I don't know why I'm saying that here in Hillsborough County, Florida.
Absolutely right.
I am saying it.
That's what was happening. People were purchasing alcohol.
How about weed if they have a card?
Listen, you're reading my list. Are you looking at the list?
No, I'm not looking at it. Really? Were they using it for
I'm
weed?
thinking you're doing them right in the order. You want to try to guess the next one?
Because I was brought up in the 70s, that's why.
No, so here's partial of the list. You cannot buy alcohol. You can't use it to buy cigarettes. You cannot use it to buy cannabis products. You hit them 1, 2, 3, Michael. Good for you. You cannot buy non-healthy foods. I am sorry, people. No Doritos, no Lay's potato chips, no M&Ms.
Bacon?
All right?
Bacon?
Bacon?
Oh, yeah,
is
bacon.
a meat. Isn't it a meat?
And it's healthy. I don't care what anybody says.
I don't care what anybody says.
Yeah,
It
that's
tastes good with everything. But no more potato chips and M&Ms, folks. You're not going to be allowed to buy
But you need that after your weed. So I'm very confused at this, but continue going. You know, we're laughing, and I'm going to stop making light because this is very serious. I mean, it wasn't as serious to me in my 50s, but in my mid-60s, everything you're saying is serious. It's life-altering.
It is life-altering.
So we're going to be serious now. Yeah.
There you go. So, no, you got to be good with your card, folks. You're not going to be able to use it to buy other insurance products. You can't buy life insurance with it. You can't buy hospital indemnity. You can't use it to buy funeral planning and expense insurance. All right? And no cosmetic procedures. No nose
That's
jobs.
normal. Yeah.
Okay, using your card towards nose jobs.
Okay.
So there is
Why are you
more
looking?
list, but I'm giving you the most common things you're not going to be able to use to purchase with your grocery card this coming year.
I think I got to be honest with you. All the things you've said, I think that's fair.
It is fair, right? I mean, come on. So people were taking advantage of it, unfortunately. And so this year, Medicare tightened up, and they're saying, no, folks, okay? You have a chronic condition. Diabetics shouldn't be running around buying 10-pound bags of M&Ms with a grocery card. Okay?
No, I think that's right.
All right, so there you go.
Now they're
So it's gonna be a
diabetic,
little
and it's
tighter.
a whole thing again, all over.
It's just all over again. So again, not too bad. Being reasonable there.
You've spent years building equity in your home, and now it's time to let that equity work for you. The fractional sale of your home equity lets you access the cash you need without taking on additional debt. It is a game-changing tool to help fund retirement, cover healthcare costs, or simply enhance your lifestyle. No monthly payments, no interest, just financial freedom. Turn your biggest asset into your greatest retirement ally through the power of fractional home equity. To learn more about this, go to www.62whoknew.com and check on the Chief's link. What's the biggest threat to your retirement savings? It's not the stock market. It's the cost of long-term care. Home care, assisted living, or nursing facilities can drain your life savings in just a few short years. That's why long-term care insurance isn't a luxury. It's a necessity. It protects your assets, preserves your independence, and gives your family peace of mind. Don't leave your future to chance. Plan ahead. Protect what you've worked a lifetime to build with long-term care insurance. For more information, go to www.62whoknew.com and click on the long-term care insurance link.
Now we're going to talk about insulin. Okay, back in 2020, we started the pilot program of bringing in insulin and capping the price for insulin for folks that are type 1 diabetics. And we got to the stage last year where most of the insulin products were capped at $35 per month. This year, it is going to be less if it's $35 per month or if it's 25% of the maximum fair price that was established under the Medicare Drug Price Negotiation Program, or 25% of the negotiated price of the Medicare Price Negotiation Program, whichever is less.
Okay, take those last two sentences and dumb it down for the host.
Dumb it down. So
Dumb it down for the
this
host.
is the year that they're going to start negotiating, okay, for 10, we'll be going over them a little later, drugs, okay, that people are taking that were expensive, okay? And insulin is now added into that program. So if they negotiate the price and if it's a Lilly product and it comes in at $20, well, you're going to pay $20 a month instead of the $35 cap,
Okay.
okay?
Okay.
So it's one or the other. It'll be $35 flat maximum per month for your insulin, or if it's one of the negotiated insulins, you will pay the price at the lower number per month, $20 per month,
Okay.
$25 per month, whatever it is.
I got you.
Not so bad.
No, still not. I'm waiting for
Listen
her
to
to
me,
turn
maybe,
the page.
maybe, it's up to you whether you think it's bad or not, folks. But So now of vaccines. So every year they've been adding a few vaccines, which is a zero cost to our Medicare beneficiaries. And now it's going to be permanent. So the list of vaccines that are listed by the Advisory Committee for Immunization Practices, okay, and every year that list gets added to, those will be free under Medicare Part D. So you won't have to pay for these vaccines anymore. And
Is COVID?
oh yes, absolutely right. You're gonna you want to go down the list?
Shingles.
Okay, not bad there, Michael.
The only reason I brought up shingles, a very close friend of mine got a very bad case of it, and he's probably the first person I actually know. I've heard, your uncle's friend, this realtor, he has shingles. I've never really known somebody, and
I had shingles.
it was very, very painful.
It is very painful. I was lucky. One day, in the middle of my hand, I had a couple of red blisters. I thought I had poison ivy, to be honest with you. I said, how did I get that? And it was just itching and bothering me, and then it started getting painful. Well, when I woke up the next morning, it's very segregated. So it was only on these two fingers, straight up my arm, up to my neck, on this side of my neck. Oh, yeah, it's very painful.
Now, there is medicine and painkiller, right?
Yeah, there is. You have to do it within a certain amount of time to get to your doctors in order to do that. And I think it's within 48 or 72 hours you need to get that. And it can last a long time for people. Mine lasted about 3 weeks. I was very fortunate. I know people that have it all over their face, in their eyes, in their mouths, sometimes down in their genital areas. It's very painful. And I can't even imagine something like that.
How to say that?
I'm sorry, but I'm just saying what it could be. So it's a very serious disease. You need time alone. Well,
is it catching? Is it contagious?
No. It's because you had chickenpox. Did you have chickenpox when you were a kid? All right, so you carry in your body the shingles virus.
Do you recommend? I know you're not a doctor, but you're an expert at
Listen, I'm certainly not a doctor.
Do you recommend the shingles vaccination? I've never gotten it.
My doctors recommend it, and even though I had it, I get it.
Is it many vaccinations like flu, they actually give you a little piece of the disease to build an immunity.
I hear what you're saying.
That scares me with shingles.
Yeah.
I can have a flu for a few days, be a little stuffy, have a 99.9 fever. So what? I don't want a little shingles to...
Yeah. I don't know if they put a
gonna do
little
some
piece of
research.
shingles in there, but it's called the zoster recombinant. That's the real name of it. So it sounds a little man-made.
It sounds...
But let's research that.
I am going to research that without a doubt.
Because that's way above my pay grade, folks. So, but here are some other ones. So we said the COVID-19, definitely you can get that 2 doses if you'd like, if your doctor recommends it. Your influenza, 1 dose annually. This is a good one. The tetanus diphtheria pertussis, TPD, they call it. You can get that 1 dose and then every 10 years after that.
All right. Well,
All right.
Okay, I got you.
Now, how about this one? Do you know that you could get the measles, mumps, and rubella vaccine if you have evidence of no immunity to those diseases?
I didn't know that, no.
But my question is, how the heck would you know
Yeah.
if you're immune to
And
those diseases?
is measles one of those things, because I had that as a kid?
Yeah.
Is it one of those things that you can't get twice? I know there was a few childhood diseases in my day.
No, you can. As a matter of fact, the measles outbreak is a big outbreak while traveling right now.
Okay, I'm just not going to leave the house other than to come here.
Just stay here.
And do the podcast.
So the chicken pox, again, you can get it as an adult if you don't have evidence of having a normal immunity to it.
I don't know how I would tell.
Obviously, there's some medical way they figure this out, but there you go. And then, of course, the RSV, which stands for respiratory syncytial virus. You've heard those commercials on TV, right?
Yes.
All right. And that's available, also recommended by the doctor. Now, there are other vaccines available only if it's coming recommended from your physician and other factors. So you mentioned pneumonia. So the pneumococcal vaccine is available as long as your doctor determines that you have at risk, okay, due to other characteristics. Hepatitis A and B is also available if the doctor recommends it. Mm-hmm. So those are the type of vaccines that you're going to be looking at that you'll be able to get in 2026 at no charge on Medicare.
I like this so far too.
You're liking it. I know you're liking it. This is my favorite. Here we are. We're ready. Do we have any kind of a
drum roll?
A drum roll? Come on, Anthony. Let's go.
Okay, let's hear it from the crowd. Okay,
there you
good.
go. I want a drum roll next time.
Get a drum roll, will you?
Okay, so
bring a band in or some sort of orchestra.
All right. Under Medicare Advantage plans, there is a lot of what's called prior authorizations.
Yeah.
All right. So someone wants to, well, let's put it this way. You go and you're walking and you're training for a mini marathon. You're walking several miles, and during your training, you fall and you sprain your ankle. You go to your doctor. Doctor says, go get an x-ray. You go get an x-ray. Well, an x-ray is going to tell you if your bones are broken or not. It's not going to tell you if you have damaged tendons or ligaments or anything like that. So now they're going to say, go get an MRI. You might probably need to get a prior authorization from your insurance carrier and get that approved before you can have the MRI. Okay, so that's pretty dominant in the Medicare Advantage industry. Pretty much go get approval before you do anything. Don't pass go, don't pay $200. Call the carrier and get your friggin' approval before you go get a test or procedure. Well, Medicare said, maybe we should do prior, because original Medicare has not done that. So little, minute for their prior authorizations.
Right.
But in 2026, we're starting a pilot program in 7 states using artificial intelligence, people.
Is there anything AI is not coming into?
I don't know. I don't know yet. But so what's going to happen is these are 7 states. New Jersey.
Of course.
Ohio. Oklahoma. Texas. Of course. If it's Jersey, we got to have Texas.
Yeah, and Texas is tough. They don't need this. Yeah.
Arizona.
Yeah.
And the state of Washington.
All right.
Well, those are all right. We're not in it.
All right.
And New York's not even in it. So
good.
That's good. So right now we're holding our breath. That's where you're going to use AI to examine, and determine if the procedure is approved under the Medicare regulations.
Okay.
Now, AI is not going to say and stamp approval or declined. It's going to recommend to the clinician whether that falls under the Medicare requirements. And then the clinician will make the final determination if it's going to be approved or denied.
Makes sense.
Okay? And this is all going under, how they love acronyms. The government loves acronyms. So this acronym is WISER. Okay? This is for wasteful and inappropriate service reduction.
I wonder if they make up the word and then they make up words to go with the word.
I think they do. Really? Do you think they would come up? Yeah, that's what they do.
It has to be.
Come on. That's the easier way to do it.
It is.
Yeah.
So
for all of you beneficiaries in those 7 states, I'm sorry, but you're going to have a little AI determining whether, your clinician should recommend whether your MRI is getting approved or not.
And that's a stepping stone to 50
we
states.
We know that.
Yeah.
Absolutely. So the insulin cap started in 2020, and here we are, 2026, where it's going to be now every year, and it's going to be a cap.
Okay.
So I would say it's probably going to take 3 to 5 years for it to be 50 states.
Okay.
All right?
Well,
so that's not a good one. I don't like that one.
That just is what it is, and it's not good for those 7 states.
It's not good. It's not going to be good for any of us.
And AI is going to become well, has already become part of our lives in so many ways.
Yeah.
But there's no doubt it's going to become part of the medical world. It has to.
How can it
I
not?
guess if I wanted to look at the glass half filled part of AI, is that if in fact it's programmed correctly, honestly, and fairly, and who would expect anything different from the pharmaceutical world, but fairness and honesty. But if it is programmed correctly, it's going to cut down on waste. It's going to. I'm trying to
Are you
play.
playing the acronym? Go ahead.
No, I'm just trying to look at it the glass half full.
All right.
It could cut down on waste. It could cut down on tens of thousands of dollars of unnecessary testing, which ultimately could have a good effect on prices of everything. Trying to see a little bit of a silver lining in this very gray cloud.
From what I'm looking at right now, if CMS did what they say they're going to do, is they're going to let AI look at this just based on the regulations in Medicare. Mm-hmm. And they're going to tell them, the clinician, yes, this falls under Medicare requirements.
Right.
That's fine. If we start advancing, we're going to be letting AI make these determinations.
Then we're going to have a problem.
We're going to have serious, serious problems.
Yeah, I mean, we already got robotic surgery, which the statistics on that is staggering.
It is.
But if you have AI making the decision on whether you need robotic, I mean, it's borderline spooky. I mean, I know it's progress.
Yeah.
But
It all comes down to money. We always say this when I'm
Yeah.
on the show. I don't know if your other guests are talking about money, but that's
Yeah,
all we
totally.
talk about is money.
it always comes down to money.
So that's what we're talking. I'm happy, that CMS is trying to look at ways to reduce waste, and fraud. But they've got to keep it in the box. They got to keep it very specific
That's right.
in what they're doing, and it worries me
I agree. I absolutely agree.
in the coming years how that will change. When on 62 and who knew, we're going to stay on top of it.
Yeah,
Okay,
absolutely.
we're gonna let you know as things progress, because I'll be looking into different states and what's going on and talking to different people all over the country, and we'll find out how
We'll
this
report.
is
Yeah.
doing. But I'm sorry, there's 7 states.
It is what it is. We've talked about this before. We may have
Yeah.
to change the name of the show to 65, and we're just trying to survive.
I know
But as long as it rhymes, people like it.
it is.
Yes.
All right, and then we're going to talk about plan changes and network changes.
Okay. This isn't going to be good.
No, this one is not good. Folks, you might have gotten your ANOC, which stands for Annual Notice of Change, from your Medicare Advantage plan, prescription drug plan. With that, it will explain the differences that are occurring in 2026, your co-payments that might have gone up, because they rarely go down, that go up, okay, what supplemental benefits they're removing, okay, from the plan. When a carrier has a Medicare Advantage plan and they're adding things like dental, eyeglasses, hearing aids, people love that since that's not part of original Medicare.
Right.
Okay, it offers them a little more in the package. But the companies are starting to pull back on it and take it away. I mean, there are some companies that the only thing they'll allow for now is a dental exam and x-ray. Mm-hmm. Period. That's all you got, folks. And in other plans, they're removing many of the benefits. You might hardly even have a benefit towards eyeglasses now.
Yeah.
Some I've seen them for $50 where they used to be $400, $500. So the benefits are coming down hard. Okay, because that's just putting money back into the carrier's pocket.
That's right. That's
Right?
what it's doing.
All right. So that is happening. A big thing that's happening, and here in Florida, it's almost like a tsunami, is the carriers are terminating plans.
So let me just be clear with this. Carriers are saying, and you'll name some, I'm sure, I don't want to do business with Medicare patients.
No, they're not saying that. What they're saying is we need to tighten our belts, and we're going to put out a new plan that's going to reduce those supplement benefits. We're hardly going to give them anything for those glasses or take away the over-the-counter benefit and hearing aid benefits. And we want people to go on this plan instead. So we're just going to take away that other one.
Wow.
That's what they're doing.
That's ultimately very dangerous
It is very dangerous.
because they're in
Okay.
total control.
Yeah,
It's my, it's my game. It's my ball. If you don't want to play, go home.
exactly.
That's not good with people's health.
No, I know. People, they fail to realize that your Medicare Advantage plan has to have every benefit under Part A and Part B. It has to be there. Okay, so if Original Medicare has it, the Medicare Advantage plan has to offer it to you. Okay, it's the out-of-pocket costs that vary so much, and they have to have maximum out-of-pockets for the year. Again, for you, what you're paying out-of-pocket for the entire calendar year. Mm-hmm. But they are tightening belts like you would not believe. I mean, I just got a notice from Aetna is one of the carriers, and I have at least 60 people on this one plan that I've got to call now and tell them, listen, folks, I'm really sorry, but this plan is not available for you next year. Okay, we're going to look at what the Aetna is replacing it with, but now we need to go through an entire review because we may need to move entirely away from Aetna program and move to a different carrier. Mm-hmm. And that's what people need to realize. Just because the carrier is putting in a replacement plan, that does not mean that that's going to end up being the right plan for you in 2026.
It's probably a one size fits all.
It is,
which works great in an overcoat, but not in the clothes that you wear every day. What an analogy!
I don't know, where the heck did you come up with
just
that?
come with that.
Where did
Let's
you
use
just
that.
come?
Let's use that as a clip. That was good. No, but it's true. I mean, a one plan fits all. That's ridiculous. There's 3 people in this room.
Yeah.
And we all have totally different medical problems.
Totally.
One plan could never fit the 3 of us.
No.
Especially since he's 12 years old, Especially since you're clean shaven, which you didn't think I noticed. But with that baby face, I don't even know how you're getting into bars.
It's pretty easy.
Is he?
You're making me blush, Mike.
Well, now I can see you're blushing.
He's a
You're
good
clean.
man. He's a good man, Anthony.
He's
You're a
the
good man.
producer. He's not just the producer.
Except I
he's
want to
the-
see a drum roll next time.
I'll have it.
All right, we'll have
There
it.
you go. So that's just one example. All of the carriers are coming forth with plans that are going to be terminated. Prescription drug plans the carriers are putting out less and less and less plans available to our beneficiaries in each state. So, I mean, there was a time in Florida a couple of years ago when we had close to 30 prescription drug plans. Last year we were at 22, and now we're under 20. So they are also doing the same thing with the standalone prescription drug plans, where they're squeezing it out and forcing people to choose either this one or that one, and it might not be right for people.
But if it's the only choices, you choose the lesser of 2 evils. But that's no way to be in your 60s or 70s or 80s.
It's not. It's really not. So we talked about that deductible that could go up to $615. Well, if they took away the third choice for you, because there might have been a carrier that had 3 choices for you, they took one away. Now they're introducing the new plan that stamps that $615 deductible on both plans. They can do that. Yeah. So let's look for a different plan for you with a different carrier that might not even have a deductible, right? Mm-hmm. I mean, there's options. And while we have the options, we're always going to look at the best one for you, because we say this all the time. Everyone is unique, has unique needs based on their financial situation, their health situation, the medications they take, and what doctors they want to go see. Are you turning 65? Well, if so, the most important decision in your life right now is to determine which Medicare plan you need to be on for your unique changes in life. Are you still working? You on your employer's plan? How about being a snowbird? If so, you need to speak to a Medicare consultant who can help you with your needs. I'm Diane Daniels, and I'm the CEO of Medicare Nation. Go to www.62whoknew.com and click on the Medicare Nation tab. I will give you a free consultation to make sure we find the right plan for your unique needs.
Planning for retirement? Your home can be your greatest financial resource. At 62whoknew.com, our mortgage link connects you to expert guidance on reverse mortgages, refinances, traditional home loans, all designed with retirement in mind. Whether you want to eliminate your mortgage payment, do debt consolidation loans, or downsize with confidence, we help you choose the right mortgage for your future. Visit the mortgage link at 62whoknew.com because the right mortgage strategy today can mean a more secure tomorrow. Which is another thing they're being forced to, I know in many cases, they're on a plan that they like, and they finally get doctors that are on that plan, and we love these doctors. It wasn't what we wanted 3 years ago, but we've developed a nice relationship, and now there's a new plan, and a couple of your favorite doctors are not on it. Again, you're 20, 30, 40 years old. So what? I'll get a new doctor. Not 65, 70, and 75. I mean, I know when we talk about my situations, I'm not changing doctors. Most of my doctors, I know for 10 or 15 years, and now we're going through the good, the bad, and the ugly at this age. And I'm not going anywhere different. This is very disconcerting. It truly is.
No, it really is. And the scariest part about it is, so the carriers contract with these physicians, and they're signing forms, but in the middle of the year, they can say, I don't want to be in your network anymore. Or the insurance carrier can say, Doc, you're not keeping up with your codes and your computers running around, so you're taking away time from your patients. We don't want you in our network. And they can change it. And then the beneficiary is stuck. They have to find another doctor. You can't just change plans to follow your doctor around.
That's right.
You just can't do that. You got to wait till the following enrollment period under a Medicare Advantage plan. So, it gets to be quite difficult. I mean, I have to tell people now, for now, your doctor is in network. Mm-hmm. That's what I have to say. For now, for today, they're in your network. I cannot promise that they are not going to be in your network for the entire year.
It's very, again, the whole premise of, I try to get back to this when I can, and I try not to bring it up when I don't have to because it's too self-serving. But the whole purpose of 62 Who Knew is the it's not just long-term care insurance and Medicare and mortgages, or annuities. It's the fact that longer lifespans is a double-edged sword if you're not prepared for it. That's 62 Who Knew. And bringing this knowledge to the masses, there's nothing we can do about the governmental changes, but we sure as hell can be prepared for it because they're learning about it from you now. And that's half the battle. You may not like the result, but it won't be a surprise.
Yeah, we don't want things to be a surprise.
Not at this age.
No. I mean, over 50% of beneficiaries do not look at other plans during the annual enrollment period.
Oh, I know. I have friends like that. I'm happy where I am. I'm going to stay.
Yep.
Was there any changes?
Yeah.
Well, what do you mean? What do you mean? What do I mean?
Well, there is an alternative, but you have to be able to afford it. Is you can look into purchasing a Medicare supplement plan, also known as a Medigap plan. Mm-hmm. So people can do that. Unfortunately, what happens too is if you have a chronic condition like diabetes, type 1 diabetes, and you're on a certain amount of insulin. I mean, I have, clients that are on 2 different insulins that they have to take 2 or 3 times a day, have serious, diabetic problems. Mm-hmm. Someone like that would want to try to get on a Medicare supplement program is going to get denied.
Because they know they're going to spend more money than they're getting.
Well, insurance
it's
is
money.
All about risk and money.
Yeah.
Okay, so insurance is risk. And once you're over 65, you're in a high risk category.
Is this a blanket statement, or am I making it too simple? If you can afford it, should you always have the med sup and not look at the other stuff? If you can afford it.
If you can afford it, it's the creme de la creme. It absolutely is.
I don't know if a lot of people, I wasn't sure of it till you just verified it. I don't think a lot of people realize that.
They don't.
And a med sub policy is not that expensive. It's money. Mm-hmm. I mean, it's money. Mm-hmm. It's not a car payment.
No, not yet.
No, not yet. It certainly has gotten more expensive. But if people understood that was the creme de la creme, and I don't think the masses do understand that, they may be willing to eat out a few times a month less. Or instead of having a $600 car payment, have a $450 to have that for the rest of their lives. I'm not sure the world knows about that.
I agree with you. I mean, I agree with you. I mean, when I do my consultations and I sit down with beneficiaries to review, I always explain Medicare thoroughly, so they understand exactly what it is and how this is going to pertain to them for the coming up year. But you have to be able to afford it because they're used to on Medicare Advantage plans probably 75 to 80% of the time not even having a monthly premium
That's
on a
right.
Medicare Advantage plan.
It's hard to be free until
is.
it doesn't give you what you need.
That's right. And I call Medicare Advantage plans the pay-as-you-go plans. That's what I coin it as. Most of the time you don't have an upfront premium, but every time you need a medical service, test, procedure, doctor visit, you're going to have a copay. Okay, so they get you on the back end instead of upfront.
Thank God for these plans. They
Absolutely.
don't cost because, so much of America needs that.
Absolutely.
But you always go back to that old cliche or old adage or proverb, whatever you want to call it. You get what you pay for.
It
if
is
it's
true.
free, I'll just leave it there. If it's free, so again, just strengthening. I should have said this 10 times in the last 40 minutes. Just strengthening the reason to talk to a professional. Just absolutely, which of course you can go to www.62whoknew, click on the Medicare Nation link and talk to Diane about this or one of her partners. Don't make this decision on your own. I'm sorry, just don't. I think it's important to know too that, are people paying a lot of money to use you?
If
I have friends using you and they're not.
Yeah, if they live in Florida, okay, I'm licensed currently in the state of Florida, and if I enroll you into a plan, it doesn't matter if it's a Medicare supplement, Medicare Advantage.
They pay you.
The
carrier
pays
pays you.
me a commission that is regulated by Medicare. I need people to understand that. It's not like, in the old days, where brokers would try to persuade you to go to a certain
That they made more money
that
on.
they made way more money on. It's not like that with Medicare. I get the same crappy commission, okay, from whichever
Not from
carrier.
the client.
No, not from the
And you
client.
do have consulting services that are available in the other states to help
In the
people.
other 49 states, I absolutely consult with people across America to help them find the right plan.
And
Absolutely.
I am proud to say that within the next couple of weeks, 62 Who Knew will be able to offer Medicare solutions in all 50 states. But we live now, here we are in the retirement capital of the nation. It just boggles me. Again, like I said, people, I'm going to just figure this out on my own. I'm going to do a little research. What?
I know. It really, why would you want to waste all your time? Okay.
Especially if you don't know what you're doing.
Well, of course, but it's like we're on the downside of the mountain now. Okay, we're in our final whatever it is that God allows us to have, and I want to enjoy myself. Okay, I don't want to be wasting my time.
Yeah.
I feel for people that want to do all this investigating for things that they're not expert in, it's just a waste of time. I'm not going to invest my time to be reading about how to invest money. I don't know much about it. I know a little bit, that and there, but I want a professional.
Yeah.
Okay, if I need someone to come because a main pipe broke in my house, I'm calling the plumber because they're the expert. I ain't going near it. I'm just shutting the water off.
That's right.
it. Okay? You need to call an expert. Don't waste your time.
Yeah.
It's ridiculous. It's silly. Okay? Because most of the time you're really not going to find the answer you were looking for.
And that's the bottom. Not only are you wasting your time, you're not probably coming up with the best answer possible.
Yeah.
Which turns
it's true.
wasting your time into an insult.
I just don't want them to waste their time.
Yeah.
They're retired. Sometimes on my phone, I put funny recordings for the voicemail, and one of them always was, "You're retired. Get out there and enjoy yourself.
That's
Get off the phone."
Get off the phone.
I want them to enjoy themselves.
Right.
They've had hard lives and had to deal with so much in their life. It's time to enjoy. Don't
Absolutely.
waste your time looking at all this crap.
All right.
It's a pain in the what.
I know there's more bad stuff coming.
Well, there is some more. So besides the plans that are terminating plans and, trying to get you to go on their replacement plan for the ones they're putting out, some big network changes, and a big one I'd like to talk about that many of you here in the state of Florida need to know about is with Moffitt Cancer Center.
Which is the #1 cancer center in the state of Florida and #5 in the country.
It is. That's right. Fabulous organization in what they do in treatment and research for cancer. And I have found out that this year, going into 2026, there are very few Medicare Advantage plans that they are accepting. which is devastating.
Yes, it is.
And I'm not kidding. This is one of the most devastating changes I have seen coming up is involving network changes and different providers that are contracting, with the insurance carriers. And I'm going to what's the number one reason, Michael, that these things are not happening?
Money.
There you go, money. And I just think it's disgusting that an insurance carrier would not want to make a deal with Moffitt Cancer Center. I have nothing. I just want to tell the audience, I have nothing to do with Moffitt Cancer.
You're not a stockholder.
Yeah, I'm not a stockholder. My brother doesn't work there. It's nothing like that. I mean, we all know that they're a highly acclaimed cancer treatment and research center. And for insurance carriers not to work out a deal so that the, almost probably 15 million Medicare beneficiaries in Florida could go to that facility disgusts me.
Is that a fairly realistic number, 15 million?
Yeah. Realistic.
How many people
Now,
are in
they're not
Florida?
always living here.
Oh, that's true, too.
Okay.
Okay.
We're
I got
coming
you.
into the heavy season where they come down
They'll
here.
come, they'll be here.
Yeah.
Wow.
But I'm really, really upset, folks, about
Me
this
too.
one. I'm actually going to reach out to the CEO, and I want to sit down with them and find out the truth about what's going on here, and is there anything that maybe myself or 62 Who Knew can do to help out with bringing, more of these carriers together, because, I mean, this is a bad one.
Let's bring them on. Talk to
Yeah,
them
I
often.
know.
Let's bring them up and on.
Exactly. I'm sorry to tell you this, folks, but if you're living in the state of Florida, okay, I have right now from the website, you could go to Moffitt right now and look it up, okay? I mean, I took this off of their site today. These are the only Medicare carriers that Moffitt is accepting right now. Humana.
I've heard of them. That's a
Yeah,
biggie.
that's a big carrier, and it's going to be for a lot of their PPO, HMO, and private fee-for-service plans. Health First,
Not familiar with them.
not familiar with them. Okay, very few areas they're in, like Brevard, Volusia,
Okay.
Orange County. So several counties going in that direction. They're not a statewide Medicare Advantage plan. Florida Complete. They're in over 20 counties in Florida.
Okay. I've
Okay,
never
so
heard
a
of
little,
them, but okay.
a little bigger. Okay, than the Health First, and then there's what's called a Velocity National Provider Network. Not familiar with them either.
Me either.
Okay, I mean I know Florida Complete, but the other ones, because they're not near us and they're all in fewer counties. That's very scary, folks. I mean, I can tell you, I've gotten over 100 calls.
Since this came out.
Yeah. And way more emails. It's troubling to the point of I'm worried for people.
Yes, so am I. I have a personal reason for being worried, and I'm going to tell our audience in about 8 weeks why.
Okay.
But a very personal reason for worrying about this Moffitt thing. I'm not only have I known people and I've had relatives, that Moffitt has cured, but
Yeah.
we'll discuss it in about 8 weeks.
I'm going to see what I could do, Michael, but it's not looking good for 2026. So I'm telling you right now, you have to review your plan.
Yeah.
You have to review. You need to call a professional. You can call me. Go to the 62 Who Knew website. Right on the homepage, scroll down to Medicare Nation. Just click on it. Leave your information. Okay, because it's a Medicare regulation. You have to contact me. I can't just call you. Okay, that's a regulation. I follow that to the T. So please go to 62 Who Knew website, scroll down, click on Medicare Nation, fill in your information. I will be happy to get back to you and help you with this. So it's very, very important.
I'm always trying to find a way to put some levity in what we do, because we talk about very serious stuff here.
We do.
Whether it's annuities or long-term care insurance or final expense insurance or Medicare. And it's kind of my job, since I'm not an expert at all of these, to try and ask some neat questions, but also, keep that silver lining.
Yeah.
I'm having a hard time with the silver lining here, because what I'm thinking, and I'm not the praying type, but if I was, what if next year it's Anderson
Yeah.
that doesn't want to do it.
Yeah.
What if?
What about Sloan?
Yeah. What if
Sloan Kettering?
What if Sloan Kettering goes, wow,
Yeah.
that really helped Moffitt, them not accepting these people with negotiating prices.
Yeah.
What, now people above 65 are going to, and every hospital is great. If we
Yeah,
have
yeah.
doctors, blah, blah, blah. Suddenly people on Medicare, either you can afford to pay on your own or you go to a lesser hospital. I don't want this to be a trend.
No.
Like those 7-state
Yeah.
experiment
Exactly.
with AI.
Which we know.
What is happening here?
Yeah.
Very, very disconcerting for our great country and for our aging population, which is what the country is right now.
Oh, absolutely.
That's it. Yeah.
We're on the tail end. We have 3 more years, I believe, where it's 10,000 people a day turn 65.
Yeah. And we're living longer.
And we're living longer.
Yeah, so they're going to be here for a while. Well, it's one of the things this show does for people, I hope, is it gives them knowledge. And as you get older, you learn that the cliches that your parents and your grandparents, always told you that you laughed as a kid, they are cliches or proverbs because 99% of them are true.
Yeah.
But some of them aren't. And we try to give people knowledge on this show. Be worried about Medicare and talk to an expert. If you're in your 50s or early to mid 60s and you're healthy enough, oh my God, get long-term care insurance before something bad happens.
Yep.
The average funeral in this country is $22,000. Get final expense insurance. You're buying, you're selling. Why wouldn't you want to use RE/MAX? Voted 11 years in a row, the most popular real estate company in the country. I'm proud of what we're creating here on 62 Who Knew. That being said, we give you knowledge. And you know that expression, knowledge is power?
It certainly is.
You ready for this?
I'm ready.
It's crap. Knowledge is not power unless you use it. Knowledge is the beginning of power. I'm 67, so basically it took me 66 years and 10 months. I learned this a couple months ago. Knowledge is the beginning of power. If you don't use it, if you're watching this and this makes you go, wow, this is bad. I'm glad I learned this. And then October 15th rolls around and you go, yeah, I'm happy where I'm at. Well, then that knowledge didn't do crap for you.
No, it didn't.
Knowledge is not power. Knowledge is the beginning
And Michael,
of power. The action is the power.
If they turn around and they say, forget about it, I'm not going to be bothered, and something happens, I mean, the pit in my stomach right now.
Yeah, me too.
And
Me too.
I've had that before where people have decided not to go with long-term care insurance, and not even a year later something happened. And there's no crystal ball.
No, there isn't.
There is not at all. Risk, insurance is all about risk and being prepared.
That's right.
That's what it is.
And there's so many statistics out there on long-term care insurance. We'll use that for a second. You have a 70% chance of having at least one long-term event. You have an 82.6% chance. A very, very brilliant person in the long-term care world by the name of Mr. Bill Comfort. I heard him say this years ago to a huge crowd in Texas. There's all these statistics out there, 72%, 80%. Yeah. Here's the scoop. It's 50-50. Either you're going to have it or you're not going to have it. Now, do you want 50-50 odds on something that major when there's an insurance policy out there for a fraction of the cost of what that event's going to cost you to protect you? Yeah. And again, I think a lot of people don't realize that either because they think of insurance as, oh my God, that car insurance payment, it keeps going up. And it's Florida. Look what those hurricanes did to homeowners insurance. Oh, the insurance is the evil. Insurance avoids risk. Insurance protects us.
Right.
I'm sorry. I know so many people go, oh my God, those insurance premiums, they're killing me. Does your $400 insurance premium on your car really kill you when one of your children hits somebody and there's $40,000 in damage? Because without that $400 premium, you're writing a check for $40,000.
There you go.
And does that medical insurance, which is so out of whack right now, a family that doesn't have major medical in a large group, is paying $1,500, $1,600, $1,800 a month.
Insane.
It is insane until one of them needs a $100,000 kidney transplant. So I'm not making the insurance industry into the angels.
No, we're not.
But I don't look at his insurance as the terrible thing that, that we're forced to have. If somebody can deter your risk, I'm falling down the steps. I pay $14 a month for insurance on this. And I think I've used it once in 20 years. But it makes me feel good because the damn thing's $1,800.
Exactly right.
And I'd rather pay $14 a month and never use it for 10 years than have to put out $1,800. Insurance defers risk. Insurance is your friend. We should have a shirt like that. Let's make shirts like that, Anthony.
All right.
Insurance is your friend.
And it gives you peace of mind.
Yeah.
It does.
Yeah. It cuts down on the stress.
Cuts it down.
And stress. We should have a whole show just
on
about stress. What stress does, not just mentally and emotionally, chemically. It cuts down on blood flow. It cuts, and the world is filled with stress today. If we start talking about that, this will be an 8-hour podcast.
Yeah, I know.
The stress in today's world that's going on so many levels, rough times right now.
Rough times.
And yet still, and I'll never not believe this, the United States of America, as bad as things are right now, and they are, still the best country in the history of history.
It is.
It just, you can't get no better. We're here. We're all living the American dream. If you're not living the American dream, well, get up and get the American dream because everybody can. And for those of you that can't, there's help out there. There is. This is still not a great country, the greatest country. And we're going to end on that note.
Not really.
No, we're not. We got Dad, don't tell me there's another bad one on the list.
No, this isn't bad, but I got to make sure they have it, all
We're
right?
not ending yet.
We're not ending yet, Anthony. All right, I got to tell people the 10 drugs that are being negotiated and will be applying for 2026.
Okay, that is important.
That's very important because a lot of people are taking these medications and it's finally going to be cheaper for them.
Oh, wow.
Yeah.
Okay, well, we are ending on a high note.
We are. I won't get the exact numbers until October 15th, but I can tell you the 10 drugs and you'll know the prices are coming down. So Eliquis and Xarelto.
Two of the most popular.
Okay, for heart arrhythmias. Okay, so those are been negotiated. Price will be coming down. Jardiance for diabetes, and they found out it also helps with heart failure.
Okay, good.
Okay, so that one is coming. Januvia, another diabetic medication. Fariga is for diabetes, heart failure, and now they found out it helps with chronic kidney disease.
3-in-1, we got that.
That one's a 3-in-1. Entresto, you've seen that commercial on television. That's out right now all over the place for heart failure. Then we have Imbruvica, which is for blood cancers. Big, very important. That's a very expensive drug. We have Stelara, which is for Ciara. Oh my gosh. Ciara.
What?
Oh my God.
In your eyes? In your back?
Blah, blah, blah. Oh my God. There are you. Arthritis. Sciatic.
What is sciatic? I don't even know that
What the
word.
hell's wrong with me? I feel like I'm having a stroke.
Don't do that because we might not be able to get
It's
you to the point.
psoriasis. Oh my
Psoriasis.
God.
Oh my God.
Oh my God, that was the biggest senior moment. My
I
God.
know.
I couldn't get it to say. What's wrong with you?
And I'm going to teach you how to remember that.
Yeah.
Because of the commercials when we were children, not Junior over there. The heartbreak of, and it'll come right back to you.
There you go.
The heartbreak of psoriasis is there with you.
Oh my God. Sorry, folks. That
Senior moment. Usually the host has it, but this time the guest had it.
So that's for Stelara. All right. And then we have some of the Novolog pens. So insulins, we talked about, we're getting it capped. But these self-injectable pens now were not covered under the $35 cap.
Okay.
So now Novolog is going to be covered, and FLASP pens are going to be covered.
I like
under
the pens for
negotiated.
doing stuff.
Everybody loves the pens.
Just put it in a click.
It's a click. So those are the 10 drugs. You're going to see the prices come down, folks, for them in 2026. And don't forget, the maximum you'll pay out of pocket is $2,100 now for 2026.
All right. So we did end on a high note.
We did end
There
on
are
a high
10
note.
very, very popular drugs that prices are coming down.
Out of the hundreds and hundreds, we got 10.
Well, hey, we did it.
We got to start.
Yeah, that's because, yeah.
AI with 7 states and 10 drugs. Okay.
Yeah.
It's a good start.
Yeah. Wow. Well, this was an incredible show. We gave some news that maybe people don't want to hear. but they need to hear it.
They
and
need
they
to
need
hear
to
it.
be prepared. And ladies and gentlemen, October 15th is so close, open enrollment season. Don't take this upon yourself. If you don't go to 62 Who Knew and click on Medicare Nation, go somewhere else. But don't do it yourself. Okay? This is not, what's the name of that furniture company, the Swedish furniture company where you put together everything?
Oh, IKEA?
Okay, this is not IKEA. I love IKEA, but you can't put together your own Medicare plan.
No.
I mean, you can, but you're not going to do it very well. It's just that simple. And I hope the thousands, if not tens of thousands of people watching, I hope, and I know a lot of them are 65 and above.
Yep.
I hope they all call you, and you need 10 more phone lines.
I hope so, too.
Just forward the
because-
calls late at night to Anthony. He'll take the calls. It's not a problem. Oh, he said that's his way of saying I don't think so.
That's his way. Oh, folks, it's okay. Just please pay attention a lot more for this year because it's scaring me, about Moffitt. God knows in your state, if you have a preferred cancer center that you go to that might now be only taking a few Medicare Advantage plans. So please, you need to be cognizant, get with an expert. Just like Mike said, if you don't want to go to Medicare Nation, I don't care.
Yeah, go somewhere.
Go call somebody, and let's get this taken care of.
I know you have the connections. Let's get somebody from Moffitt here, even if it's not the CEO.
No, I will.
Yeah.
I absolutely
Not the
will.
janitor.
No,
but
no,
even
no,
if it's not the CEO.
I will.
To ask why. Because you know what? Moffitt might have a good reason. We tend to villainize the person making the change, but they might come back with something to have you go, whoa, that does make sense. Now, how do we come to the middle? Yeah, let's get them on.
We got to do something.
And if we can do that, Anthony, with all the guests, that we have booked in the next 3 months, if we can get somebody from Moffitt on here, that'll be the first week we do 62 Who News as a special edition with Moffitt. Because Moffitt's special.
Oh, my.
Moffitt's special
it
to
really
a
is.
lot of people in this country.
It certainly is. People come from different states, just like people go to Dean Anderson or go to Sloan.
Yeah.
They come to Moffitt.
Yeah, they do.
It's a big hospital, fifth, like you said, in the nation.
Yep. And number one in Florida. All right, ladies and gentlemen, thank you for being here at 62 Who Knew. Remember, go to www.62whoknew to not only find Diane and Medicare Nation, but all the other things we talk about on this show to help you prepare for the last 20 or 30 years of your life, because they should be the best 20, 30 years of your life. And we want here at 62 Who Knew to make that happen. Have a great week. We'll see you next week. Take care.